NCLEX note on musculoskeletal system. Today, let's start with rheumatoid versus osteoarthritis. And it is also important to know the difference between these both conditions for the NCLEX. Both of these are the common form of arthritis. Rheumatoid arthritis is an autoimmune disease, while osteoarthritis is a degenerative joint disease. In rheumatoid arthritis, there is inflammation, pain, potential joint deformity, and which commonly affects to the smaller joints like finger and wrist. On the other hand, osteoarthritis commonly affects to the weight-bearing joints like knee, hip, spine. RA can be systemic, but osteoarthritis is typically localized and does not involve systemic inflammation. Rheumatoid arthritis tends to cause morning stiffness and joint swelling, whereas osteoarthritis is characterized by pain that worsens with activity and improves with rest. Must know for the NCLEX. Okay, let's study these conditions separately. RA is a chronic systemic autoimmune disease that primarily affects the joints, leading to inflammation, pain, stiffness, and eventually joint damage. And the causes or risk factor of RA are rheumatoid factor, age, family history, autoimmune diseases, cigarette smoking, trauma, infection, obesity, rheumatic disease, stress. And key signs and symptoms are rheumatoid nodules, arthritis signs and symptoms like pain, swelling, warmth, pain, stiffness, like morning stiffness, and nodules. And all the treatment is needed in this condition because it can be severe if not treated on time. Commonly used medications in RAR, NSAID, steroids, DMARDs, disease-modifying anti-rheumatic drugs, biologic agents, physical therapy are needed. Timely treatment or medical management on a time plus physical therapy can help to improve the quality of life of a patient. And the nursing managements are like encourage for range of motion exercise, help with daily activities, control pain and inflammation using NSAID plus corticosteroids, assess for complications because patient is under immunosuppressive medications, so regular check for skin breakdown around joints especially with prolonged immobility, assess for other symptoms, complication like lung issues or cardiovascular disease, reinforce education, teach the patient about their disease, medication regimen and lifestyle changes. Okay, the next topic is osteoarthritis. OA is a degenerative joint disease characterized by breakdown of a cartilage in joints leading to pain, stiffness and swelling. Typically affects the weight-bearing joints. Must remember for the NCLEX and to differentiate from the RA. And the causes and risk factors are like older age, family history, activity like joint overuse, repetitive motions, cartilage damage, trauma injury, obesity, repetitive movements, and the sex more common in women, especially postmenopausal women. Key symptoms of OA are osteophytes, ache in joints, pain, afternoon stiffness, instability, no systemic symptoms. Cause it is localized and non-inflammatory condition. And also remember in this case the pain that worsens with activity and improves with rest. Must remember for the NCLEX. And for the medical management, oral analgesics for the pain management, activity modification, avoid excessive joint stress, therapeutic exercise like strengthening exercise for joint support, low impact exercise like swimming, rehabilitation, physical or occupational therapy, education on weight management, encourage weight loss to reduce stress on joints, arthroplasty, surgical interventions like joint replacement, and other topical treatment for pain relief. Now here we go for nursing management of patient with OA, oral medications for the pain, assistive devices to reduce joint strain, comfort, use heat for muscle relaxation and cold therapy for inflammation, encourage for low impact exercise and weight loss to reduce joint pressure, refer to physical or occupational therapy to improve mobility and strengthen, teach joint protection techniques, medication adherence and lifestyle changes. The next topic is osteoporosis, which is bone disease characterized by low bone mass and structural deterioration of bone tissue, leading to increased fracture risks, and it is most common in postmenopausal plus older adults. The risk factors are older age, sex, more common in women, thin body, estrogen deficiency, osteoporosis like family history, reduced calcium and vitamin D, inactive lifestyle, smoking, kidney disease. And the key symptoms are like fracture, most common in the hip, spine and wrist, back pain due to vertebral fractures, loss of height, stooped posture like kyphosis or Dwyer hump, bone tenderness. For the medical management, we use bisphonates, osteoclast inhibitors, nutritional therapy like calcium, vitamin D supplementations, estrogen therapies for postmenopausal women, weight bearing and strengthening exercise to improve bone strength, use of acetaminophen or NSAID for pain relief, and treating fracture or prevention from complications, immobilization, pain management, or surgery might be needed in severe cases. And the nursing managements are bone health education, offer fall prevention, nutritional support, regular exercise plus promote weight bearing and strengthening exercise, support medication, timely medical management, and monitor for side effects. Let's go on another topic, that is muscular dystrophy, which is also known as MD. It is a group of genetic disorder characterized by progressive muscle weakness and degeneration due to abnormal muscle protein production. There are two types, Duchenne muscle dystrophy and Becker muscle dystrophy. DMD is most common and severe form, occurs in early childhood. The Becker one is less severe and with later onset. And the sign and symptoms are progressive muscle weakness, Gower sign like difficulty standing from sitting position, loss of muscle mass, frequent falls, trouble walking, cardiomyopathy and respiratory issues in later stage. For the medical management, corticosteroids are used like prednisone, physical therapies, surgery for deformities like scoliosis, cardiac and respiratory support, and the nursing managements are monitor respiratory function, understand the progressive nature of MD and offer emotional support to the patient and patient party, support mobility, encourage physical therapy and assist with mobility aids, cardiac care, lifestyle modifications, educate families on disease progression and safety measures, coordinate with multidisciplinary care like physical therapy, cardiology, respiratory therapy, assess for complication, reassure emotional and psychological support for the family. Okay, now let's go on the most important topic for the NCLEX, that is fracture, and knowing the complication is also the important. A fracture is a break in continuity of bone, often caused by trauma, falls, or stress. It can lead to infection, fat embolism, compartment syndrome, DVT, delayed union, non-union, or malunion. And the sign and symptoms are pain, swelling, deformity, inability to move, tenderness, crepitus, and skin changes. And another important topic is management of fracture. We do immobilization just after if we know that there is fracture. Surgery in some cases like internal fixation or external fixation. Pain management is key, like you use NSAID upwards. Antibiotics if there is open fracture to prevent from infections or prevent from complications. Physical therapies to restore the function and mobility after fracture heals. And the nursing managements are fracture site assessment, assess for deformity, swelling, abnormal positioning, review patient history including mechanism of injury and risk factors, assist with immobilization, circulation checks, regularly assess pulse, capillary refill, color and temperature, teach patient safety, understand complications, rehabilitation, emotional support, care of open fracture, assess for shock, record vital sign, monitor for complication, evaluate healing. And the NCLEX key concepts are immobilization is crucial to promote healing. Compartment syndrome is a nursing emergency. Watch for pain, pallor, paresthesia, paralysis and pulselessness. Fat embolism. Watch for dyspnea, confusion, tachypnea and tachyresis, especially with long bone fracture. These is the key things you have to know for the NCLEX. Let's go on another topic, that is gout. It is a form of inflammatory arthritis caused by the accumulation of uric acid crystals in the joints, leading to sudden severe pain, swelling and redness, commonly affecting the big toe. And the risk factors are genetics, family history, obesity, uric acid, high uric acid level, trauma, injury to the joint, renal disease, intake of urine, purine-rich foods, sex more common in men, kidney stones related to high uric acid. Sign and symptoms of gout are severe joint pain, often in big toe, swelling and redness in affected joints, warmth over joint, intense pain that often starts at night, tophy, hard, painless lumps of uric acid crystals under the skin in chronic gout. And for the medical management, we use NSAID for acute pain and inflammation, colchicine to reduce inflammation and pain in acute attack, corticosteroids for severe pain, allopurinol or febuxostat to lower uric acid level to prevent future attacks, Prevention increase the exhaustion of uric acid in urine, and adequate hydration to promote uric acid excretion through urine. And most remember that colchicine is used for acute attack and allopurinol is used for long-term management or to prevent from future attacks. And for the nursing management, educate on gout and its triggering agents, observe for sign of acute attack, severe pain, redness, understand the triggers, educate on food high in purines, treat pain, administer prescribe NSAID or colchicine, and assess pain level, check renal function, advise on lifestyle changes, review medication, ensure adherence to allopurinol or febuxostat to prevent further attacks, encourage fluid intake. So here we go to know about some important topic from the musculoskeletal system. So what is fat embolism? This is life-threatening complication which occurs after long bone fracture, most known for the NCLEX, and also the most common complication from femur fracture. It occurs when fat globules from bone marrow enters to the bloodstream and travels to the lung, brain, or other vital organs. And signs and symptoms include dyspnea, hypoxia, tachypnea, confusion, and patchy rash. Management includes early stabilization of fracture, oxygen therapy, and supportive care. In some cases, mechanical ventilation might be needed. And another important topic is compartment syndrome. It is also the important topic for the NCLEX from musculoskeletal system. It's a medical emergency that occurs when increased pressure within a muscle compartment compromises blood flow, leading to tissue ischemia and potential nerve and muscle damage. Fracture, cross injury, tight cast can lead compartment syndrome. Symptoms include severe pain, paresthesia, pallor, pulselessness, and paralysis. If it is not treated on time, it can lead permanent damage to the muscle and nerves. Early recognition and intervention are crucial, with treatment typically involving removal of the constricting cast. Dressing or fasciotomy procedure might be performed, which is surgical incision of the fascia to relieve pressure. And the next topic is cast care. It is important to know the nursing management of a patient who is under cast. Nursing management involves assessing neurovascular status, pulse, capillary refill, temperature, and sensation to monitor for complications like compartment syndrome or circulatory impairment. Skin care is also essential to prevent breakdown, especially around the cast ears, and the patient should be taught to keep cast dry. And early sign of complications must be promptly addressed to prevent further harm and ensure proper healing. And next topic is above the knee and below the knee amputation plus phantom limb pain. In this condition, patient still feels the pain on a leg which is already amputated. And the nursing management includes medications like analgesic, anticonvulsants, antidepressants, along with therapies like mirror therapy and desensitization exercises. Nurses should assess for sign of phantom limb pain, provide comfort measures, and educate patient on coping strategies. And in case of post amputation, must watch for signs and symptoms of bleeding from the site of amputation. Let's go on another topic, that is hip replacement and total knee arthroplasty. The nursing management post-surgery includes pain management, monitoring for sign of infection, assessing neurovascular status, circulation plus sensation, and promoting early mobilization to prevent from complications like DVT and pulmonary embolism. Patients should be educated about weight-bearing restrictions, range of motion exercises, and proper positioning to prevent dislocation and complications. Complication might include hip dislocations, infection, DVT, hip or knee stiffness, and prosthetic failure. Sprain and strain. Sprain is an injury to a ligament caused by overstretching or tearing, typically resulting from sudden twisting or impact. A strain involves an injury to a muscle or tendon due to overstretching or overuse, often seen in back and hamstring or calves. Being a nurse, we must know the sign and symptom of these conditions, like both have pain, swelling, bruising, and limited range of motion. And it is important to know the nursing management for the NCLEX. We can use mnemonics, RICE, like rest, ice, compression, elevation. And the pain management is done with NSAID and immobilization if needed. In severe cases, physical therapy may be required to regain strength and mobility. Now let's go on assistive devices, which is the important topic for the NCLEX, like can, crutches, walker, are the main topic to know for the NCLEX. For all these devices, know the nursing management. The can should be held in the hand opposite to the affected leg to reduce stress on the injured or weak side. Instruct the patient to move the can forward first, followed by the affected leg and then unaffected leg. Adjust the can to the patient's height, ensuring top of the can reaches the wrist crease when standing. Monitor for proper posture, walking techniques to prevent falls and promote independence. And when using crutches, the patient should bear weight on their hands, not under armpit, to prevent knob damage. Crutches should be adjusted to the patient's height, with the top of the crutches about 1 to 2 inches below the armpits and the hand grips at the level of wrist. The patient should use the crutches in the tripod position. Instruct patient to maintain an upright posture, avoiding leaning on the crutches to prevent strain and ensure stability. And when using walker, the patient should stand upright with their hands gripping the walker's handles at the level of their wrist. The walker should be moved forward first, then the patient should step forward with weaker or affected leg, followed by the unaffected leg. The walker should be adjusted to the patient's height with the elbow slightly bent when standing straight. Instruct the patient to maintain an even, steady pace and avoid leaning on the walker to reduce the risk of falls. And now my topic ends here from the musculoskeletal system. If I have left any topic, please do comment. I will make note on that topic. Thank you for watching and do subscribe my YouTube channel.